Hello, our students. Our subject for this day is intrauterine contraceptive device, IUCD. Types of IUCD. Non-medicated IUCD plastic inert devices, which often contain no any substance, and it is not used nowadays. It causes heavy and more painful period. We have medicated IUCD. Copper iucd available in various shapes and sizes, and we have a progestogen releasing IUCD that is called Marina. This non-medicated IUCD ليبيز لوب self-T coil belt and shield. مثل ما تلاحظون السايز مال ال IUCD يكون كبير، راح ياخذ كل اليوترين كافيتي، يشتغل as a barrier method، يمنع ال ascending of the sperm. إذن there is no any substance, only inert. Medicated, we have copper T IUCD and levonorgestrel IUCD. هاي النوعين هي most popular use. This table is for your knowledge، للاطلاع، ما مطلوب الحفظ، بس دارد أوضح لكم إنه according to the concentration of the copper, there will be different years of efficacy. We have copper T 380, 8 to 10 years, copper T 200, 4 years, copper T 375, 5 years, and Nova T 385 years. This is different types of IUCD. The most popular and used in our country is copper T 380 and Nova T 380. Informations given to women seeking for IUCD contraception. مثل ما لاحظنا ومثل ما شفنا بالcontraception. First of all, full history and examination should be taken from the patient in order to exclude contraindication for the device. Later on, there is information should be given to the patient regarding this device. أنطيها معلومات حتى تكون الصورة واضحة عندهم. We will told her about different types, mechanism of action. Regarding to the mechanism of action, حيكون عندنا first of all inhibition of fertilization. It is a toxic effect to the sperm, to the ova, and even to the embryo. إذن ال IUCD abortificant? No, it is a prevent fertilization. Chemical reaction prevent implantation. In addition to that, impaired cervical mucus. Another information given to the patient, failure rate 1%. The effect on the period make the period heavy and painful, so it is non-logic to be used in a patient with already heavy painful period. يعني مو مريضة عندها heavy or painful cycle أجي أحط لها. It is not suitable for the IUCD insertion. Return to the fertility. هذا السؤال تسأله دائما المريضة. راح تقدر ترجع تصير pregnant بعد ال IUCD? The answer is yes, and it is immediately because it not affect the ovulation. Another information should be given to the patient, the advantages of the IUCD. First of all, it is long-term reversible. وقت ما تريد تشيله تقدر تشيله. Cost effectiveness. تخيلوا مريضة تحط ديفايس بسعر معين حيكون أرخص بهواية من إنه تاخذ contraceptive pills monthly، فحيكون السعر كلش فرق بالنسبة إلهم. Can be removed when the patient want to get pregnant. اللحظة اللي تقرر تريد تصير بيها pregnant نرفع الديفايس البريجنانسي يكون immediately. Coital independent ما تحتاج any action during the sexual intercourse. Good compliance. It is very suitable for women because it not need to be remembered daily or weekly. ما تحتاج المريضة إنه تحسب كل يومية البيلز أو مثلا الباتش أو الرينج. It is fitted and effective for 5 years. Risk. Perforation 1 per 1,000 mainly at time of insertion. Expulsion 1 per 20 mainly in the first 3 months. Infection 1 per 100 mainly in the first 3 weeks of the use. The most common infection is actinomyces. Missed thread. شنو نقصد missed thread؟ يعني المريضة من تجي للكلينيك for checking. We should see and palpate the thread within the vagina. In this condition, it will be not palpated and not seen. It is called a missed thread. وراح ياخذ many causes, maybe pregnancy, maybe expulsion, perforation, or coil within the cervix. هذا الموضوع راح ناخذه بالتفاصيل بالlast session. Another risk, heavy painful period. Pregnancy. ال iucd prevent pregnancy, but once the pregnancy takes place with the iucd, the risk of the ectopic pregnancy is 3 to 5%. Finally, ectopic pregnancy. Contraindications. First of all, STD or PID. We mean by it is acute infection. يعني مو مريضة قبل 3-4 سنوات مشخصة ب PID أو STD أني أعتبر ال iucd contraindication. نقصد ال current within first 3 months. A previous history of ectopic pregnancy. Non malformation. تعرفون ال device يحتاج good cavity to be inserted. So if this cavity is obliterated by malformation or by a big fibroid, it is a contraindicated. كبر allergy لأن هو بيكبر. malignant trophoblastic disease. gestational trophoblastic disease ما المفروض استعمل iucd because risk of perforation. unexplained vaginal bleeding. endometrial and cervical carcinoma. A previously placed iucd فالمفروض أني أشيله يلا أحط لها واحد جديد. hormonal releasing intrauterine system IUS Marina. It has a capsule contain levonorgestrel. It dose 52 mg. Its daily releasing dose 20 microgram. Years of efficacy 5 years. Informations given to women seeking for IUS. نفس الشيء همين الانفورميشن راح اعطيها التايب mechanism effect on the period return to fertility advantage disadvantage complication contraindication time of insertion. When the complication takes place she should seek for medical consult. نفس الحكي اللي حكيناه بالايucd ينطبق على ius. mechanism of action prevent implantation. This is the primary action. السبب إنه endometrial atrophy, thickening of the cervical mucus to prevent the sperm entry, but it not inhibit ovulation. Failure rate 0.1%. Effect on the period become irregular, spotting in the first 3 to 6 months. By the end of the first year the patient become amenorrheic. يعني المريضة 3-6 شهور راح تظل تعاني من السبوتينج، لكن بعد 6 شهور إلى حد السنة المريضة راح تصير completely amenorrheic. ولهذا it is very effective in the patient suffering from the heavy menstrual bleeding. Return back to fertility immediately after discontinuation. Advantages. In addition to the iucd advantages, we have hormonal advantages. Number 1, a dramatic reduction in the menstrual blood loss, so it is effective in the patient with a heavy period. In addition to that, it acts as a hormonal replacement therapy in the postmenopausal patient, a protection against pelvic inflammatory disease, management of endometriosis, adenomyosis, premenstrual tension syndrome, a protection against endometrial carcinoma. Disadvantages. Persistent spotting and irregular vaginal bleeding in the first few months of use. Progestogen side effect, acne, breast tenderness, mood changes, and it is also expensive. ولهذا المريضة بسبب هذا السايد effect والspotting sometimes seek to remove the IUD.